Hey, it's Jess. Alright, today we're doing an ABG. First I'm going to obtain my equipment, and you're going to have a blood gas kit, which is going to have the syringe and the stopper and the point lock device, an alcohol swab, a gauze, and a biohazard baggie and a label, but we don't have those today with us. Alright, so first what I'm going to do is I'm going to review the patient's chart. I'm going to verify that they need an ABG, that there's an order put in, and if there's any recent FiO2 or ventilator changes. If a patient just had a ventilator change, we have to wait 10 minutes to take an ABG, but 25 minutes if the patient has a history of air trapping, lung disease. Then we're going to look at their history, make sure there's no wrist, arm trauma, anything like that. If they have a dialysis shunt, we don't want to do that on that arm. And if they're on any anticoagulants. And then we're going to look at their lab panel to make sure that they have adequate clotting time. Then I'm going to walk in the room, introduce myself, say, "Hi, Mr. Jones, I'm Jess, a respiratory therapy student. I'm going to take arterial blood gas today." And then I'm going to go over to the sink, wash my hands, and put on some gloves. Now, to choose their puncture site, I'm going to most likely choose their non-dominant hand unless there's any reason that I can't do that. And I'm going to do the Allen's test. Casey's going to be my demonstrator today. I'm going to do it nice and tight and have her squeeze her hand 5 times. And I'm going to let go of this arm and make sure that she has adequate perfusion into that hand. And it did turn pink within 7 seconds, so that's good. That means I can use that hand. Alright, now we're going to make sure that the syringe has at least 1 milliliter of air in it. It should already come like that. And then I'm going to open the sterile gauze, and that's already open. And I'm going to put it on the patient's hand so I have it all ready for me. Alright, now we are going to puncture. Take this off. Alright, then I'm going to check for a pulse. Alright, continuously. Once I get it, I'm going to inform the patient that it's going to feel like a big pinch. And put in 45-degree angle, and then it's filling up. Alright, and then I'm going to take it out, and then immediately put pressure on the patient. Alright, and then I'm going to put in this red thing, but we want to save needles, so I'm going to do it this way. And I'm going to have my assistant come and hold this for me. And applying pressure. Alright, dispose the needle in a biohazard. And then without touching the end, I'm going to put this on here. And then shake it. Get all the bubbles out. And then when that's good, I'm going to put it in a biohazard bag that we don't have today. And then this is disposed. And then I'm going to label it. I'm going to write an ABG, that's an ABG, put the date and time of the sample that was drawn, the room number, and the FiO2 setting. And then I'm going to, if the patient's on a ventilator, I'm going to note the mode, the respiratory rate, the tidal volume, the peak pressure, and the peak. And have it in the biohazard bag, and then take that to the ABG analyzer. I'm going to assure that the patient is all comfortable, put their remote by their side, ask them if they need anything, and then answer any questions that they have. And then I'm going to analyze the sample and document the procedure and